Well, I think we can start and more people join later. As this meeting will be recorded, everybody will have the chance to watch again if any may lose the first introduction. So to start, I want to thank EuroBloodNet, Eurordis, Lymphoma Coalition, Cutaneous Lymphoma Foundation, and France Lymphoma Espoir for joining efforts to put this program together. And I want to thank you, everyone, for joining the first session of the European Reference Network EuroBloodNet Topic on Focus for Patient Organizations, Cutaneous Lymphoma, how to connect patients in Europe to cutaneous lymphoma experts via the European Reference Network. Today, we will have two speakers to present the content of this webinar. They are Pierre Aumont and Dr. Martine Bagot. But before introducing them, I want to thank Susan Thornton. She is with us today. Susan is the CEO of the Cutaneous Lymphoma Foundation and is the president of the Lymphoma Coalition. She has a long first-hand experience as a patient and is one of the most acknowledged expert voices to talk about the cutaneous lymphoma patient experience and the unmet needs of these conditions. So, Susan, thank you for promoting so much this series of webinars and for working together with so many more people behind the scenes. And I want also to thank Lorna Warwick, the CEO of Lymphoma Coalition, for all the effort behind and for being with us today. I want to introduce Pierre Aumont. Pierre, welcome. He is a French patient advocate, vice chair of chronic lymphocytic lymphoma Advocates Network and a board member of SILC, the Association for Support and Information for Chronic Lymphocytic Leukemia and Waldenström patients. The sole association provided information and support to the CLL patients in France. And he also serves as an European patient advocate as well as with EuroBloodNet. Dr. Martine Bagot is professor of dermatology and head of the Department of Dermatology in St. Louis Hospital in Paris, France. She's leading a national reference center and network for cutaneous lymphomas and is actively participating to international trials in the field. Professor Bagot has been board member of the European Society for Dermatological Research and is currently board member of the International Society for Cutaneous Lymphoma. I'm very glad to welcome you both, and please, the floor is yours.
Thank you, Natasha, for this kind of introduction, and thank you, Mariangela, for sharing the slides. As an EPAG means representative of patient within EuroBloodNet, I will try and describe the way how we work and what is, at the end of the day, what is EuroBloodNet. EuroBloodNet is, of course, one of the reference networks that has been created by the European Commission, trying to deal with rare diseases. Of course, rare diseases are facing specific issues and, often limited knowledge, affecting less than 2,000 individuals. So it's difficult to get data, it's difficult to get experience, and joint effort are absolutely key in this respect. So the European Commission created so-called European reference networks. Those networks are virtual networks involving specialized healthcare providers across Europe. And they aim to facilitate a discussion on complex and rare diseases. So the reason why those networks try to be as active as possible. The number of this network is relatively high, 24 at the beginning, and some may be created, well, I should say, if needed. And those 24 ERNs are involving more than 900 highly specialized healthcare units from 300 hospitals in 25 EU countries, plus Norway. So it's a huge effort, of course, to join those, to make those the many specialized units to work together in order to try and solve the special issues for those rare diseases. Well, among those networks, virtual networks, there is, of course, the network dealing with hemopathies, and this network is called EuroBloodNet for all rare hematological diseases, and we will come a little bit more on the network later on. You see that the members that are involved, the member states that are involved in not the member states, the members, official members involved in these networks are high, 60 members. And for those who are not yet full members, there is a special status for 14 member states. You can see the description here, and if for instance I take the example of Austria and Denmark, they are extremely active within the network, even not being full members. So it doesn't, well, at the end of the day, it doesn't matter really. So there are also so-called national coordination centers for other member states. But do remember, it's not a problem. The important point is that every country are involved, and this network are very active throughout whole Europe. Next slide. So let's come to EuroBloodNet as such. Well, as I said, it is a very ambitious network because it covers all rare hematological diseases. And as you can see here, there are two coordinators, Professor Venno and Professor Gulbis. And Professor Venno is especially focused on the malignant diseases, and Professor Gulbis focused on non-malignant diseases. So the malignant diseases, for instance, myeloid malignancies, lymphoid malignancies, histocytic disorders, and among the very numerous non-oncological diseases, you can see rare red blood cell defects, bone marrow failures, rare bleeding coagulation disorders, and hemochromatosis and rare iron metabolism disorders. You see, it's a large range of diseases that makes, as I said already, EuroBloodNet a quite ambitious network. And this network, next slide please, is trying, of course, to focus on special diseases. You will see that today with cutaneous lymphomas, but it's also trying to tackle some common issues among the diseases. And those issues are very important issues anyhow, as you can see. Cross-border health, meaning as you may know, all countries are not at the same level by treating some disease, and especially rare diseases. So how can we use the competencies from one country to help patients be cured or treated in other countries? Best practices, of course, that is some kind of benchmarking related to rare diseases. Then, as soon as we are talking about rare diseases, medical education is, of course, a key topic. It seems normal, but don't forget that rare diseases are not that well known, and it's quite important to have that to keep that in mind. Clinical trials, of course, and research. Rare diseases need a very accurate amount of research. And last point, it is, of course, telemedicine, and telemedicine is not specially focused on rare disease. It's an overall question. Well, that is the focus of EuroBloodNet. And as I said, of course, healthcare centers are involved, clinicians are involved very closely, but not only. The patient's voice has to be heard in these networks. So you have the so-called European patient advocate groups that are, let's say, advising the networks in order to not to forget the voice of the patient, because at the end of the day, what is important is to cure the patients, of course, or to treat the patients properly. Well, EPAG were at the very beginning elected by the community, and now they are nominated by the peers, and we try to have a proper representation of the patient in the networks. So as you can see in the next slide, for EuroBloodNet, we have 8 patient representatives. I won't go into detail. I am, of course, one of them, but as you can see, men, women from quite different countries in Europe, and specialize in quite different diseases as well. So we try and represent properly the whole patient's community related to the disease that are covered by EuroBloodNet. Before I go into the detail of the next slides, I will try to tell you what are my own feelings about that. The ERNs have been created in 2016, so 5 years ago. And EuroBloodNet is a very large and ambitious network with, well, let's say a certain complexity. So we experienced this complexity, and we had at the beginning a little bit of difficulty to go through the complexity. And then we decided, and when I say decided, we were as patients as well interested in this decision, to concentrate, to focus on very concrete cases. And all the tools that we are trying to develop is, and you'll see in the slide, in the coming slide, let's apply to very concrete cases, and that's the reason why we came to cutaneous lymphoma. Cutaneous lymphoma is a very rare disease, quite difficult to manage, quite difficult even in the diagnosis of this disease. So it was a very good target in order to make clinicians share their experience and make patients let their voice be heard for this very special and rare disease. So you can see in this slide on this slide what we are trying to do. Education and online programs for health professionals, but not only for patient organization as well. That's the reason why we have this webinar for the patient organization. E-learning platform, telemedicine through a very special mean that has been developed within the European Union. Trying to centralize the access to cutting-edge diagnosis tools and therapies above borders. That's very important, but not every country is specialized in cutaneous lymphoma. Collection international guidelines, quite difficult as well because it's a very specific disease once again. And assisting the patients in searching expert healthcare provider, and cross-border health. That's the ambitious program we have tried to put in place. I will stop here, and Bagot will provide you with more details focused on this disease. Thank you very much for your attention.
So good morning, good afternoon, everybody. So I want to speak to you, how can we help to connect patients in Europe, both patients together and patients to cutaneous lymphoma experts via the EuroBloodNet network. So first, in each country, so many countries in Europe have actual cutaneous lymphoma network. I know that it is the case in Germany, it's also the case in Netherlands, also in Italy, in Spain. And I will give you the example of France because I'm working in France. So in France, we have a group that had been funded many years ago called the French Study Group for Cutaneous Lymphomas. And actually, this group is labeled by a cancer institute, in National Cancer Institute. But actually, we also work with French-speaking countries, that is not only France, but also Belgium and Switzerland. And what we are doing is that we review all pathology cases. All the pathologists review all cases so they ascertain the diagnosis of cutaneous lymphoma. And we have multidisciplinary meetings both at the regional and the national level. And we present difficult cases to help to make the diagnosis and also to define the best therapeutic choices. And this clinical expert work is labeled by a national institute named Institut National for the Cancer. And we also work very closely with the France Lymphome Espoir, that is a French patient association that is working in a Saint-Louis Institute. So this is an example of the information that we did both for doctors on you know that there are many books on cutaneous lymphomas in English, and we did books in French to help both dermatologists, but also oncologists, hematologists, and you see that there are books on the clinical point of view, books also on a histopathologic point of view. And interestingly, on the right part of the slide, we did with France Lymphome Espoir a book for the patients explaining a different types of cutaneous lymphomas, and we are giving this book to the patients. But now, next slide, we are coming to the European level. And also at the European level, it is very important to develop information for doctors and patients. And as you know, on the EuroBloodNet's site, there is a repository of educational material on the website, and there are also several online educational videos on EuroBloodNet's YouTube channel. And you can see an example of this video, all the webinars we did for the health professionals and for the patients are put on this YouTube channel. And so this is the example of the program, the webinar program on cutaneous lymphoma for health professionals. I will speak about that later. And this program for healthcare professional consists of 8 sessions, and to be accredited for 7 CMA points, you need to have 8 sessions accredited, and this comprehensive webinar program is available on EuroBloodNet's YouTube channel. And so this is the program of this webinar. You see that this webinar began 1 year ago, and you see that there are very well-known experts in the fields of lymphoma in Europe, professor of introduction, and then different subtypes of mycosis fungoides. Actually, we did all these sessions, and this formation was very well attended and give very precise information for all health professionals in Europe and also outside Europe, as you will see. Here you can see the results of the attendance of these health professional. You see that there is a majority of health professionals from Spain, because Spain, I think, is very well organized. ERN is well organized in Spain. But as you can see, there were also attendance from all countries of Europe and also outside Europe. You see that there are also some connection from USA, from Argentina, from Brazil, from Mexico, Iraq, and so you see that it was a very well attended webinars. And you can also see that dermatologists, most attendants were dermatologists, but you see there are also quite a lot of attendants that were oncologists, hematologists, and we also evaluated that there were a lot of young practitioners that were connected to these sessions, and so we had the feeling that it was very useful for the information, and that this field of cutaneous lymphoma needs to be wise advertised, because it's a rare disease, and there were many practitioners that were very happy to have this type of information. Okay, so I'll now, Mariangela, maybe you present the next slides.
Sure. Thank you, Professor Bagot. So for who doesn't know me, I'm Mariangela Pellegrini. So I work for the ERN-EuroBloodNet, and I'm in charge of education and patients program. I will be more than happy to introduce some slides today. So a first tip for giving to the audience of patients organization is that on our website, no matter when you click, it's always present a contact us button, and it will direct you to our emails, and you can contact us for, well, let's say any reason. If you need some material and you cannot reach it, if you want to know some information about guidelines, if you need some cross-border health assistance, we are not directly actors. Let's say the ERN is not directly an actor of cross-border health. We cannot give solution of problems that cross-border health could present in the process patients sometimes starts. But of course, we can be the moderator among all the actors, administrative, bureaucratic, and political actors for the cross-border health. So sometimes there are patients that would like to access some services in another country. We cannot help them in the whole the process, but of course we can give as much as information we could. And also we can help in searching experts and patients organizations too, if needed. And for specifically for cutaneous lymphoma, if you look for information on experts, physicians, or also patients organizations that collaborate with us, you have a specific section in the website which is called task force, as you can see in the slide. And then there are subgroups of task force, because there are also for other diseases, not only for cutaneous lymphoma. Then you click on cutaneous lymphoma and you can see all those active actors that collaborate with the ERNs. Some are members of the ERN, some are not members but actively collaborate. And so you could have basically 18 physicians and 3 patients organizations. The patients organizations are the same here present today, so they collaborate with us for this webinar. And the 18 experts you find here are a group of health professionals identified, let's say, by peer partnering of the ERN-EuroBloodNet consortium. So as said, some are affiliated partners, some are members of the ERNs, and some other are supporting us. And finally, you have also another tool on the website, which is the search expert that you find under membership, when you can click primary cutaneous lymphoma or also subgroups of cutaneous lymphoma, and you will see by countries who are the expert, this time members of the ERNs, who create themselves the profile on this section. This means that sometimes some information are lacking. And in this case, I really recommend if there is a patient or a patient's organization in search for expert, to contact us if information are lacking. Maybe they are looking for an expert, I don't know, in Italy, and they find no information, or in another country. Contact us, because sometimes we have more information that for any technical reason are not yet on the website. So the floor is again to you, Professor Bagot. Thank you very much.
Thank you. Thank you. So the second very important action of the cutaneous lymphoma task force is the clinical patients management system cutaneous lymphoma. Next slide, please. So it was very important to establish a EuroBloodNet's Cutaneous Lymphoma virtual board of experts. And this board was established, as written here, to provide expertise in different identified and agreed initiatives to cover the needs due to the ultra-rare prevalence, using the facilities provided by the ERN, and using both, as we saw, educational programs, both for health professionals and patients, telemedicine by CPMS, we'll speak about that, and also centralizing the access to diagnostic tools and therapies, and developing international guidelines. Next slide, please. So the characteristics of cutaneous lymphomas is that they are very rare cancers. They are very heterogeneous, so they differ greatly in prognosis and also in the therapy. And it is very important to have expert diagnostic and therapeutic advice. And it is very important to get this advice. And not all countries do have these experts. For example, some small countries do not have so many experts for cutaneous lymphomas. And so the challenge was that the knowledge should not be available only in specialized centers. And to address these medical needs, as we already speak, there were 2 initiatives have been developed. We already speak about the webinars, and now we'll speak about the cutaneous lymphoma virtual boards in CPMS. Next slide, please. So this is the model development, was, as you know, to recruit and train first a board of experts in cutaneous lymphomas registered, to establish video meetings to discuss cases, both diagnosis, treatment, and follow-up, and also to develop the logistics for timeline outcome report delivered to the patient. Next slide, please. And so first objective was to recruit and train a board of experts. And so we now have 18 experts in this EuroBloodNet's cutaneous lymphoma virtual boards. We have a majority of dermato-oncologists, 11 dermatologists, 3 dermato-oncologists, but we also have hematologists and hematopathologists, and also oncologists. These centers, both of these experts are affiliated through our members from EuroBlood centers, but some are affiliated, and these members have been selected based on their possibility to access to advanced medical tools. Next slide, please. And so this is the number of all the board experts on cutaneous lymphoma. Most of them are very well known in the field of cutaneous lymphoma in Europe, and they're also very active in these CPMS meetings. Next slide, please. And the second aim was to establish regular video meetings to discuss cases, as I know, diagnosis, treatment, and follow-up. And it was needing to train the experts in the system, to define a structure for regular meetings, and to develop the management of the meeting at the clinical and technical levels. Next slide, please. And finally, to develop logistics for outcome reports that were able to be delivered to the patients. And so it was needed to develop a logistic that the conclusion of the meeting is recorded in an outcome report, and also the outcome report is shared with the referring physician. Next slide, please. And so, as I told you, several workshops were experts was designed, and we defined roles. The first medical moderator is Professor Martine from UK. The secretary of the meeting is Professor Ulrike Wekamp from Germany, and we meet on a regular schedule once per month, every first Wednesday of the month from 5 to 6 p.m. And we also have a summary of the meetings written, also available for cutaneous lymphoma virtual board experts. And there is a generation of the outcome report within 2 weeks by a medical moderator. And so this is very important, because if you are in a country with not so many experts in cutaneous lymphoma, it is possible to submit a case to this board of experts and to have a summary and advice at the European level. Next slide, please. And here are the experts actively participating in this CPS meeting. You see that there was quite a wide variety of countries involved in these sessions. Next slide, please. And so this is there are challenges, because at the beginning the technology was quite difficult, and now recently in the past months has been established simplified features for the platform. It is possible to do PowerPoint presentations. It's also to have a standardized CPMS case consultation form, and also simplified logistic of outcome report. And it is possible to reduce the generation from the report from 2 weeks to 2 days. So recently it has been, at the beginning it was quite not simple procedure, but now the procedure has been considerably simplified. And finally, next slide is to advise our European meeting, but also many friends from US and from all over the world are attending. It is the EuroTC cutaneous lymphoma meeting that will be held in Marseille in next October in presential, we hope, and we are of course all invited to attend this very interesting meeting. Thank you. Now I think all of us are open for the questions.
Thank you very much, Pierre and Dr. Bagot, for such interesting presentation. And yes, it's time to start with questions. We'll remember the audience, you can bring your questions, write them in the chat. So in the meantime, as we get your questions, I want to start by asking, in a practical way, would you describe how the process should be? I mean, how does a patient go about asking for your expert help?
You mean how the patient should do to have an? I think if the patient is in a country that is part of the network, it is better to ask to the doctors that are members of the network within the country. So that's a quite easy solution. Of course, if the patient belongs to a small countries, for example Latvia or Bulgaria, you have to think what is the best contact, because often these countries have contact in other countries, for example in Denmark or in Germany. So I think if the patient do not manage to this, maybe it's possible to write to I don't know, to the head of the network, or to the president of the CPMS, for example Professor Martine, to ask that they want to have an advice, and maybe to send the presentation, all the results. Of course, to give an advice, it is important to have a proper, very precise results for the clinics and for the histology, because that might be a limiting important limitation if we do not have a very well defined histology. It is very important for the diagnosis of cutaneous lymphoma, as you know. And also for some patients, we also need flow cytometry. So it's important to know if the patient has had access to all these informations or not. And if not, maybe to find a solution for him or her to have access to these diagnostic procedures.
If I may, of course, the patient association
also,
may provide some help to the patients and introduce the patients to the clinicians, be it in their country or other countries, through a EuroBloodNet, for instance.
Of course, but for countries for which there is no representative, maybe they can ask to the country beside. I don't know, what is your advice for that?
Yeah, I'll jump in here. This is Susan Thornton from the Cutaneous Lymphoma Foundation. I think, EuroBloodNet also offers the opportunity for folks to contact them directly for help, but we also have a pretty good connection, I think, with the clinicians globally, and can try our best to let people know who might be closest. Or sometimes I know we've also tried to connect, at least if we have a physician in a country, to connect them with Professor Bagot or some other member of the International Society for Cutaneous Lymphomas in a country that might be close by. Or sometimes the patients have family members or friends in a country where they can go, and there's a clinician in that country. So we try to help navigate people to the best of our capacity to the easiest place. And I think with this whole project and process through EuroBloodNet, that takes that whole opportunity to get patients, the care that they need and the diagnostics that they need to a whole new level that I think is really going to have a big impact, especially as the process continues to unfold and get better, and the communications get better, and we're able to share this information more broadly, so that those kinds of connections between clinicians in country and clinicians in countries that may not have experts can connect back into these experts who can really help to facilitate the diagnostics and then the review. Because I'm, as Professor Bagot knows, it's very challenging to diagnose this disease, and you need the right tools, you need the right diagnostics, you need the right expertise together to really be able to provide the appropriate diagnosis and then therapy afterwards. So I think it's all of us together, really, but being able to help navigate and work. And that's why this is such a great opportunity that EuroBloodNet has taken on. It's a big project, and one that isn't perfect, but it's really a great start.
Sure. Thank you. Thank you, Susan.
Yeah, always happy to help.
We have some more questions. We got in the chat one. It's about how can a patient be presented to a virtual board of experts? Is that possible? I mean, directly coming into the board of experts?
I think that the best way, as we already said, is to be connected with a member of the board, or that the doctor send, if it's not possible to have an expert, the patient can send, of course. But I think the ideal way would be that the patient association gives the connections to lymphoma experts not too far from the country or the town where the patient lives. Yeah, to have all the information and to have a contact also for the future. Because after the diagnosis, it will be the patient will have to be followed and to be treated. Mm-hmm. And so if it's necessary to identify a doctor not too far from where he or she lives.
Okay, I wonder if EuroBloodNet offers expert advice at the highest level only to member states, or it can bring benefits broadly?
Maybe Mariangela, you can answer that. I think it's open to all, yeah. Or Pierre, maybe you can answer.
Well, it's a question, of course, that is not that easy. For instance, if you understand that Brexit could be an event that could compromise some relationships, I think it's quite clear that at the scientific level, at the medical, etc., we are keen to go on with all cooperation that are possible, and not only taking into account the very official ways that we can follow, that we may follow within the European Commission. We have to make the difference between official, that's my own opinion, that's not an official opinion. Maybe Mariangela could tell something else, tell you something else, but my conviction, my opinion is really that we will do everything that is possible to make it possible to help the patients on a scientific point of view, on a relationship point of view, on an informal point of view, if necessary, and the official questions, such as Brexit, for instance, will be one side of the game, but the other side of the game is to go to concrete results, and we are keen to go on. And well, I mentioned Brexit because let's say the UK was and is very, very much involved in the ERNs and EuroBloodNet especially. And I think it would be, of course, a very bad decision to say, well, now we forget absolutely the United Kingdom as if it didn't exist anymore. We will try our best, huh? And that is the case for all the countries that are globally and geographically in Europe, I guess. So, Mariangela, maybe I'm wrong. It's my own.
So the answer the question is yes and not. So EuroBlood offers expert advice at the highest level. If we, for that, we are referring to the telemedicine advice, so the second opinion or the first opinion that the board of experts of cutaneous lymphoma through the telemedicine platform gives. Only European member states can ask for that. So if we are strictly referring to the telemedicine and official second advice from experts, only European members. That's also because of many reasons. For instance, the GDPR regulations, because we insert personal data on the platform, and we need to know that the countries that are inserting through via the physicians that have access to CPMS, that all these data are conform to the GDPR. So for the CPMS, only European member states. Then, if we think about how EuroBloodNet could generally improve people live within conditions in finding diagnosis or looking for information, in having contact, of course, this could be done at any level in the world because our website is there. All the information are accessible. It has happened that some external, let's call like these member states, ask for information. If we can, we provide informations. Also because, as said, all the information we can provide are publicly available on the website. So the task force, the virtual board, and the search for ERN-EuroBloodNet members. But the message is that telemedicine is only for European member states.
Well, in addition to what you are explaining, I just would like to say that as a representative of the Lymphoma Coalition, I want to tell everybody that the Lymphoma Coalition is a global network of patient organizations. We are 83 patient organizations from 52 countries, so we can help to connect also patients and patient organizations with experts all over the world. And we are working close also with the EuroBloodNet now. And hopefully in the near future, we may be that channel to expand this benefit. Because the biggest current problem is that countries with the greatest needs are the countries with the least access to the assistance you can provide. I mean, EuroBloodNet can provide. What's more, in many countries, there is a lack of health information available for cutaneous lymphoma to patients in their own language. So it's important to work together to change that, and that in the near future we could have a repository also of documents available in different languages. From the Lymphoma Coalition perspective, I can tell that we have already available some documents for patient organizations in a big number of languages for European countries, 31 in concrete. I don't know, Susan, if you want to add something. We have had 2 comments. We have received 2 comments on the chat. One is about problems for patients before the diagnosis, is that they do not know they have cutaneous lymphoma because sometimes more than 10 years without the right diagnosis. So what can be done to improve that?
Well, I think, again, and I'll just jump in here quick, because I think that's what is so important of being able to network with all these various groups, from the clinical community and the communities that are in country, with the organizations that are in country, and us as the Cutaneous Lymphoma Foundation and EuroBloodNet and Lymphoma Coalition. The challenge, I think, well, there's probably multiple issues around getting a good diagnosis, and the disease itself makes it very difficult. And I know Professor Bagot can speak to that, because it does get misdiagnosed as other skin conditions often. And that's kind of the nature of the disease itself in early stages. And so I think using EuroBloodNet and what has been transpiring in the last year to educate a broad clinical community, so that the awareness of even thinking about a diagnosis for cutaneous lymphoma enters their mind, will help, I hope, with some of that earlier diagnosis. And I think when Professor Bagot showed who participated in the clinical health professional webinars, and the younger clinicians, and the broad geographical scope, I think that's really important, and something that we need to continue to work on, is to get the word out into the broader community so that the awareness is there, and then being able to plug people into the right clinicians, the right networks, and to get them access. It's a work in progress. And then as the science continues to evolve and we learn more and more about the disease itself, and have better diagnostics and so forth, hopefully that will also make it easier to diagnose way sooner than currently, which is an issue. And one I think we're all aware of, and trying to find better ways to raise that awareness out into the general community. I'm sorry, Professor Bagot, you probably have a better response to that.
No, I fully agree with that. It is the knowledge in cutaneous lymphoma has to be not only improved, but all the physicians have to know about cutaneous lymphomas, not only dermatologists, but all general practitioners, hematologists, oncologists, and this is the best way to increase an early diagnosis. In countries where there are a lot of dermatologists, often the diagnosis is made earlier than in countries where there are not so many dermatologists, because dermatologists are more trained in cutaneous lymphoma. But I think that all doctors, all the clinicians should be trained to cutaneous lymphoma, and the level of awareness of this disease has to be increased. That's what Susan was said. And in that sense, the ERN actions are very important to improve the knowledge on this disease, of this rare disease, that they exist, and how that it's possible to think about this disease. And when you have seen some pictures, you think about the disease. Thank you.
Okay, thank you. There are only 2 minutes left. However, I would like to bring one question that is on the chat, and it's about if patient organizations are involved in trying to get national networks to use the EuroBloodNet resources. So I don't know, Pierre, if you could tell us what can be done to improve this connection or this awareness also, because as far as I understand, there is also a lack of awareness among the patient organizations on the EuroBloodNet possibilities.
I mean, if I understand the question correctly, it is how can we manage within a country among the patient associations to get access to the ERN skills and tools, etc. The clinician groups. Well, I mean, it's not an easy question. I am really trying to say always and everywhere that we must have the closest connection between the different associations. So I mean, the best way for the patient to get informed properly, to be active in his disease, is to get in contact in a patient association, patient advocates, and I am really trying to make the dialogue between the different patient associations possible within the countries, and then after that, of course, we can introduce patient association to the right level of competency. As a matter of fact, France Lymphome Espoir and Silk that are dealing with on one side lymphoma, on the other side chronic lymphocytic leukemia, are trying to work together and even to merge very, very soon. So, I mean, the cooperation between the associations is probably one of the answers. Perhaps not the only one, but one of the answers within the countries.
Thank you very much, Pierre. Well, I recognize that also putting in place this series of webinars is an effort also to connect the patient organizations with the reference networks and to improve understanding and awareness on how to connect with the experts. So hopefully after the end of this series of webinars, we could also get together to think of the next steps. Maria Angela. I don't know if you want to add anything before closing this webinar?
Yes, so concerning this point, I completely agree with Pierre and you, Natasha, because it's a very important point. I love this definition of the ERNs, that is the network of the networks. And it works for patients' organizations and for expert physicians too. And for being networks on the networks, it should be bottom up. So from local to European, which is ambitious and challenging, and it's very difficult. So I'm the first one saying that. And I think, yes, that we should really work together to see how we can improve these connections among networks from local to European. So new action will be very welcome. And if some ideas came also from those webinars, will be very well welcome. So I will just share last time my screen. I'm now. So just to repeat to all of you that you can find the videos of the webinars and information of the webinars, not only on this topic on focus, but also in other disease and for other targeting patients community, on patients organizations, patients professional. On our website on education, you will see they are split in patients and professional. And also on our YouTube channel, we have an educational channel which is called EuroBloodNet Edu, and you will see there are many videos. And of course, this is the calendar of the next sessions for the topic on focus for patients organizations on cutaneous lymphoma. So the next one will be the 31st of May with Professor Martin Berber and Mike de Leeuw. I'm sure I'm not pronouncing well the name and surname. I'm sorry for that. So we'll have a session in Introduction to Cutaneous Lymphoma, the true prevalent subtypes, mycosis fungoides, and Sézary syndrome, diagnosis and staging. And then also the other section in June, July, September, and then October. And finally, if you want to be updated on everything that is going on in the ERNs, so you can subscribe to our newsletter and our social media channels, so Twitter, LinkedIn, and Facebook, and also on YouTube. So I really want to thank you, all of you, for being here, the audience, the speaker, Martine Bagot and Pierre Aumont. And I also want to thank again all the patients organizations that have really greatly collaborate with ERN for putting together this program. So I want to thank Lymphoma Coalition. I want to thank you, the Cutaneous Lymphoma Foundation, and the France Lymphoma Espoir too. So thank you to all of you, and I hope to see you also on the 31st of May with the next session. Bye-bye.
Thank you. Thank you. Bye-bye.
Thank you, everyone.
Goodbye.
Bye-bye.
Bye. Good to see you all.